Hi, welcome to today's video. We are carrying on our conversation about knee arthritis. So, if you've had the diagnosis of knee arthritis, you may have heard these descriptions that the joint is wearing away, you've got bone on bone, and you need to protect your joint. So, we'll just go through what the research is telling us in the next few slides. Spoiler alert, the knee joint isn't wearing away. Bone on bone is not the best description for that knee. And the fact you need to protect your knee joint, I'd actually say, yeah, it's a good idea. But also, protect all of the joints in the body. It's not just the knee. So if you want to know a little bit more about your triggers for your knee pain, download our free guide, scan the QR code or the links in the description below. The QR code will stay up on the next few slides. So over the last 17 years, I have definitely seen how the wear and tear mindset makes people stop doing the activities they like, which actually they can end up in a worse situation by not moving. And when I started to think about the wear and tear description, it just didn't really make sense to me, which I'll go through in the next few slides. But just if you have a think about it, how can one knee wear out more than the other? And generally speaking, people have one side that's worse than the other. So yeah, it doesn't really make too much sense. So let's have a look at this wear and tear myth, which suggests that we are cars and we're just going to wear out over time. Now, it'll be no surprise to you that we are living and breathing, and there's blood supply to all of the tissues. There is a limited blood flow to the cartilage. I've gone through this in a different video. Think about the cartilage more like a sponge. So it actually needs movement and compression. So getting up and walking about to move that fluid and nourishment around. So movement nourishes, and that's definitely what the research is telling us. So the movement does not wear that knee away. Moving on to the pain and that bone on bone, people think that x-rays will show them what's going on with their knee and give them some clarity. But x-rays don't show pain. So what we're finding is that the x-ray can show really limited gap between the two joints, and it can look not great on the x-ray, yet when you speak to the person, they've either got no pain or they've got a little bit of a niggle. So that doesn't equate to what the x-ray is showing. And on the flip side, you can have x-rays that look pretty good, yet the person is coming along with a lot of pain. So there's no correlation between the x-ray and the pain. Now, here's something just to think about, particularly keeping in mind that bone on bone kind of thought. Pain can change on a daily basis. Does your x-ray also change? And generally speaking, that structurally the x-ray will stay the same, yet you can have pain or no pain. So again, there's not really that correlation. So what's the impact of all of this? You believe that your joint is wearing away with this old-fashioned information that's out there. And so what do? You avoid activities that you love, or just avoid activities, even if you don't love them. And so stopping moving will lead you to secondary problems. Now, anyone that stops moving is going to get these problems. And that's going to be weak muscles, your joints are going to get stiff, and you're going to get pain. Now, with that arthritis and your belief that the joint wearing away, you've got more pain, it's going to falsely confirm your thoughts that the joint is wearing away, your arthritis is getting worse. So you just get yourself into this little bit of a cycle, and you need to break the cycle, somewhere. The research is telling us that gentle movement is safe. And in fact, it's a really good thing to do. Take your pick as to what you want to do. Make sure you enjoy it. That's the only thing. So you've got your cycling, swimming, gardening, walking, anything else, as long as you like it and can stay consistent. And now, knowing all of this starts putting you back back in control of what you want to do, and you can start taking action. I definitely suggest that you challenge that wear and tear story that you've been hearing. Think about it over the next few days. Sometimes it takes a little while just to digest what we're saying. You can definitely do those gentle movements. In fact, we would strongly encourage the movements. You can build on your activity levels. You are stronger than you think. And you're always going to monitor your symptoms, just kind of checking in how you're doing. So Please share this video with someone that might be stuck in the wear and tear mindset. And don't forget to download your guide on what's triggering your arthritic knee pain. It just goes through all of the different areas that could be contributing to some of that knee pain. And comment below. I'm interested to hear from you. What surprised you most about today's information? Has it changed how you think about knee arthritis? And then moving forwards, you're starting to understand a little bit more about what's going on in the knee, and it will make you think about what treatment options are available to you. And you may have been told that surgery is the only option, and we'll go through that in a little bit more detail in our next video. I just want to help you make those like better decisions, just a little bit more informed. Thank you very much for watching, and I'll see you soon.